How do doctors diagnose a rare thyroid storm? Imagine a situation where a person with known hyperthyroidism suddenly becomes extremely ill with a high fever, rapid heartbeat, confusion, and difficulty breathing. This is a medical emergency called a thyroid storm, and quick diagnosis is essential. Doctors start by carefully examining the patient's symptoms. They look for signs like a very high fever, often above 38 degrees Celsius, a heart rate that beats over 130 times a minute, and mental changes such as agitation, delirium, or even seizures. They also check for signs of heart failure, gastrointestinal issues like nausea, vomiting, diarrhea, or jaundice, which all suggest severe systemic involvement. While these symptoms point strongly toward a thyroid storm, laboratory tests are also important. Blood tests usually show very low levels of thyroid-stimulating hormone, often less than 0.1 milli units per liter, because the body is producing too much thyroid hormone. At the same time, levels of free thyroxine and free triiodothyronine, the active thyroid hormones, are usually elevated. However, it's important to remember that extremely high hormone levels are not always necessary for a diagnosis. The severity of symptoms matters more. Additional tests might reveal other abnormalities such as high calcium levels, high blood sugar, or liver function changes. Blood cultures, chest X-rays, or urinalysis may be done to find or rule out infections or other triggers that could have precipitated the storm. To help confirm the diagnosis and assess how severe the condition is, doctors often use scoring systems like the Burch-Wartofsky Point Scale. This scale assigns points based on temperature, heart rate, mental state, presence of irregular heart rhythm, heart failure signs, gastrointestinal symptoms, and any recent illnesses or injuries. A score of 45 or more strongly suggests a thyroid storm, while a score between 25 and 40 indicates an impending crisis. These tools help doctors make quick decisions, but because thyroid storm can be deadly, treatment should start immediately based on clinical suspicion, even before all lab results are back. It's also crucial to distinguish thyroid storm from other critical illnesses because many symptoms overlap. Doctors will look for clues in the patient's history and may order additional tests to identify underlying causes like infections or heart attacks. Managing the precipitating factors is just as important as treating the storm itself. In summary, diagnosing a rare thyroid storm involves a combination of recognizing characteristic symptoms, performing targeted blood tests to measure thyroid hormone levels, and using validated scoring systems to evaluate severity. Because this condition can progress rapidly and become life-threatening, healthcare providers often begin treatment based on clinical judgment without waiting for all test results. If you or someone you know shows signs of severe hyperthyroidism with systemic symptoms, seeking urgent medical care is vital. Always consult healthcare professionals for personalized diagnosis and treatment, as individual cases can vary widely.